Hello, everybody, and welcome to Altered Tissue and Cellular Proliferation. Here are your objectives and outline. And we're going to talk more about cells. This is kind of your biology review. We're going to talk about cellular growth, death, and injury. So I want you to imagine an adult and a child standing next to each other, and you can probably easily tell that an adult is larger and is more developed, and this is the result of cellular growth. So we want birth, growth, and of cells to occur. Now, if you think of a cell like a lump of clay, each cell, as it's born, is like a lump of clay, and then because of genetics and different hormones and different protein processes, that cell is molded, or you could say the proper term is differentiates into a cell that it's supposed to be. In other words, a functioning cell that's a skin cell or a muscle cell or a nerve cell. And that differentiation is what makes a cell a very workable and usable cell. Now, when there is growth, birth, and growth and development, this is greatly influenced by partially genetics and also from different hormones. And there's a lot of different hormones that assist in cell growth, development, differentiation. We're only going to talk about one, and that's erythropoietin. So when we look at the word, the term, the medical term of erythropoietin, we see that erythro means red, poietin means to stimulate. And so we know that erythropoietin is made and secreted by the kidney whenever the body needs more red blood cells. So erythropoietin not only produces or is kind of responsible for ensuring that the bone marrow produce red blood cells, but it's also responsible for the growth and development of those red blood cells. If there is less erythropoietin or no erythropoietin, then there will be fewer RBCs will be made and the individual can have anemia. And we've looked at anemia before or learned about anemia before, that it's a state of having fewer red blood cells than normal. And think about the clinical manifestations or signs and symptoms of your patient with anemia. And hopefully your mind went to shortness of breath, fatigue, weakness. If you don't get anything out of this course, you should know the signs and symptoms of anemia. When we talk about birth, growth, and development of cells, we know that all living items, plants, animals, humans, do have a lifespan. That means that at a certain time frame, then their time is done and they will die. And when we talk about cell death, normal cell death, in other words, a cell that is born, grows, and develops, and then lives up all the way to the end of its expected lifespan, then normal cell death is known as apoptosis. And if you think about a specific example, because we were talking about a red blood cell, well, the red blood cell lifespan is somewhere in the neighborhood of 120 days. And of course, humans have a much longer lifespan. Now, anywhere along that continuum of birth, growth, and development, and apoptosis, the cell can be injured. And we've really already talked about a lot of things that can injure cells. Perhaps you didn't think about that, but if you think about topics that have been covered, such as cyanide ingestion or exposure, or genetic injury, or hypoxia, or nutritional deficiencies, all of these will cause injury to cells. So we're really going to continue on that same theme, because I want you to get out of your head that an injury to a cell is not just a baseball bat that's beating upon someone. Injury to the cell can be anything that occurs, any stressor that occurs, overheating, ischemia, carbon monoxide poisoning, and so on and so on. All of these things can cause injury to the cell, and ultimately what occurs? A decreased ATP production. So that's where I want your mind to always go, is that injury to the cells can be from lots of different things, and that the ultimate end result is that the cell makes less ATP. So here we have our normal continuum where you have birth of the cell and then normal death after the life cycle of whatever cell it is that we're talking about, and then anywhere along that continuum there can be injury to the cell. And so here then we go down to cellular injury. So what happens when the cell is injured? Well, it depends on a lot of factors, and all of this is written in your notes, so you can either pause, take a moment to look at this slide and see the picture representation, or here are the terms. Again, cell injury occurs, and the ability of the cell to adapt, to heal itself, and then continue to stay alive through its normal lifespan is going to greatly depend on the type of cell, the cell's level of differentiation, and the cell's ability to adapt, because certain cells, high-level cells such as nerve cells, they have a better or greater ability to adapt. And then, of course, it greatly depends, as far as the cell's ability to repair itself, will depend on the type of injury, the severity of the injury, and the duration of the injury. But whatever happens to the cell, whenever there is any kind of cell injury, it doesn't matter what it is, whether it's heat, whether it's a microbe, whether it's hypoxia, whether it's a baseball bat, whatever cellular causes the cellular injury, the first step to healing is inflammation. And this is very important because, again, perhaps inflammation was not a term in your mind that said healing, but that's what inflammation is. It's the first step to healing. So when we talk about cellular adapting and healing, there is a process. And I have a mini concept map on the next slide. Again, all of the words are here, but here's the concept map. Again, the cell is injured. Doesn't matter what kind of injury it is, it all is the same to the cell. Somewhat. We're going to say it is the same because we're in black and white mode. So whatever happens, there's injury to the cell, and at that injury will cause some kind of disruption to the metabolic pathway. So all injury will cause some kind or some amount of disruption of that metabolic pathway. What was produced in the metabolic pathway? Well, it was ATPs were produced, and if the cell lacks or is disrupted by injury, then less ATPs are going to be produced. Now, what is the purpose of the cell making ATPs? The majority of the ATPs that are made by each cell is really made and used to work the sodium and potassium pump. So let's review that the sodium potassium pump, for whatever reason, the way we're made is that sodium constantly wants to sneak into the cell, and potassium wants to leave. And the cell doesn't like that. The cell wants and therefore uses most of the ATP to pump out sodium and bring potassium into the cell. If there aren't enough ATPs, then the whole sodium-potassium pump goes kaplooey. And that causes, or that allows, that sodium molecule or electrolyte to freely enter the cell. Wherever sodium goes, water will follow. So as more and more sodium enters the cell, then water follows, and this causes the cell to swell. Now, if you think about a membrane, the cell membrane is being a fence around the cell. As the cell inside swells, then that membrane can be disruptive. Of course, the fancy term is the cell membrane loses its integrity. In other words, it pops open, it breaks open, and that will cause cellular, intracellular substances to leak out. Yes, as that water goes in, all of the substances, the endoplasmic reticulum and all those cell biology things, they swell too. But really, for our course, what you have to know is that the sodium and potassium pump is disrupted, sodium sneaks in, water follows, the cell swells, and the membrane pops or breaks, and the intracellular substances leak out. The intracellular substances leak out. So now if we go back to our little diagram, we see that when injury occurs, this causes inflammation, which is the first step of healing, and there is various degrees of cell swelling and cellular leakage. So again, when we use an example about cell swelling and leakage, let's look at a picture representation that whenever there is cellular injury, and we're going to say that the staph have staph aureus, so those are microbes that live in harmony with us on the skin. Those staph microbes have somehow gathered a foothold into the skin, in through the skin. Let's say the mosquito bite occurred, and so somebody scratched, this little kiddo scratched the mosquito bite, and on their fingers was the staph aureus that allowed to get a foothold. And that staph aureus then injured the cells, the skin cells, which triggers inflammation. The skin cell metabolic pathway is disrupted, meaning the sodium-potassium pump that gets rid or removes sodium from those skin cells is disrupted. Water enters, and those skin cells now swell and then break. So they leak, malfunction, and that is what you are seeing here is the evidence of the leaking. Now notice I have inflammation and leakage highlighted because that's the things that I want you to think of because of now and later, because we're going to do a lot more information about inflammation in greater detail. But whenever I say inflammation, you say leakage. Inflammation, leakage. Inflammation, leakage. Now, what the heck is leaking out? So let's use muscle cells as an example. Inside the muscle cells, there are certain intracellular substances, and some researcher has identified what those intracellular substances are. And if that muscle cell were to become damaged, again, if there's any kind of injury, ATP is less, the cell swells, and then it breaks and leaks out those intracellular substances. So what is in muscle cells, you ask? Well, here we have it. Creatinine kinase. This is stuff you need to know. Creatinine kinase is an enzyme that is found in most muscle cells. And for our course, black and white, we're going to say all pathophysiology muscle cells inside the cell have creatinine kinase, or CK. All muscle cells have myoglobin. It's a type of protein. And whenever there is cell injury, then that substances, CK and myoglobin, will leak out. Now, there's another substance known as troponin, a type of protein molecule. This is actually found only in heart muscle cells. Heart muscle cells. Now, note that there is always a small amount of CK, myoglobin, and troponin in the blood, and some researcher has determined what normal blood levels of these substances are, but why would there always be some CK, myoglobin, and troponin in the blood? Well, you asked, because of apoptosis. Remember that all muscle cells, all cells have a lifespan, and once that lifespan has been achieved, whenever that cell death is time, then again, when that cell dies, then it will release the substances, the intracellular substances. So there's always a little bit of substances in the blood. But if there is a huge or a much greater amount than what is deemed normal in the blood, then we know that cellular injury is occurring at a much faster rate than normal. So let's use an example. Let's say an individual was in a building in San Francisco when a hurricane occurred, and that building collapsed on somebody's legs. What's going to be noted by the healthcare providers when that individual is rescued? Well, they're going to see, or there will be evidence of the dead muscle cells intracellular substance at a much higher level in the blood. So creatinine kinase and myoglobin will be evident or elevated in the blood level. And I've given you an example here that if there's severe muscle trauma, then these values can go greater. And it is equivalent that the more muscle damage there is, the higher the number. And that makes sense because of the more and more and more muscle cells that are damaged or injured, then that more and more intracellular substances are going to leak out. Now, what about if there is myocardial damage? We used the example earlier where we had a blockage in a coronary artery and that caused myocardial cell damage and death. We know that if there is myocardial damage, yes, the CK and the myoglobin will be elevated because all muscle cells, including myocardial or heart cells, have CK, creatine kinase, and myoglobin within their cell structure, but also troponin. So this is very helpful for a healthcare provider because it specifically identifies that, hey, this is not just somebody complaining of chest pain, that they have muscle chest pain. This is somebody that is complaining of chest pain because the heart cell has actually been damaged, as evidenced by the troponin in the blood that is elevated. Now, just about every cell in the body has certain different intracellular substances. And for example, again, this is kind of FYI information, if a liver cell is damaged, then there are other enzymes such as AST and ALT that are going to be elevated. This information you'll learn more about as we get towards the end of the semester, but most cells in the body have intracellular substances that, when elevated in the blood, identify to the healthcare provider that something's wrong with that particular cell. And so there is a lot of information on intracellular, specific intracellular substances. What you need to know right now is that if an individual has muscle cell damage, the CK, creatine kinase, and myoglobin are going to be elevated. And if it is a heart muscle cell, then CK myoglobin will be elevated as well as troponin. Now we're going to talk about some other examples of cellular injury, and we're going to do some specific items, and the first one is going to be ischemia. Now, we've heard about this term before, and it was identified that ischemia results because of oxygen deprivation to the cells. Now, it's very important that you understand, again, the medical terminology, because there is a specific term that defines or indicates cell oxygen deprivation, and that is hypoxia. If it was blood oxygen decrease, then that's hypoxemia. So again, hypo is fewer, emia is fewer oxygen in the blood, but hypoxia is less O2 in the cellular level. But ischemia means more than just cellular tissue deprivation. It means cellular tissue deprivation because of a decrease in arterial circulation. And there's many causes of why there is less blood flow to a cell, but the majority of the time it is a result of narrowed or blocked arteries. Now, the narrowing and blockages of arteries can occur suddenly. That would be an acute ischemia. In other words, hypoxia, lack or no oxygen to the tissues from sudden lack. And the example I'm going to provide for acute ischemia is going to be an arterial embolus. So if you look up at the top of the screen right here, there's a red dot. And if for whatever reason a embolus, which is a blockage of some substance that's creating a blockage, were to travel in big blood vessels and then go down to the much smaller blood vessels, let's say in the feet, then this blockage is stopping all oxygenated blood from getting to the feet and toes, and the individual will complain of pain in their toes, and of course we identify that as ischemic pain. Now, we've talked about ischemic pain, the same result as in hypoxia to the cells, mostly in the joints, but the cause was different. It wasn't an embolus, it was the fact that red blood cells were oddly shaped, they're sickled, and so that stopped them, the oxygenated red blood cell, from allowing it to get down to the tissue. So different methods or different causes of acute ischemia, and here's your two examples. Now, chronic ischemia is usually, anything chronic is usually better tolerated because it's a gradual thing and the tissues have the ability to adapt. And so therefore, when we talk about chronic ischemia, what we're talking about is the narrowing of arteries over a long period of time. And of course, this can occur because of certain problems, but it can occur beginning in young childhood all the way up to adulthood, where arteries are gradually causing problems that are blocking them. But regardless of whether the ischemia is acute or chronic, if it continues to a certain point, and that's where we say the time factor comes in, when that cell over a longer period of time is without oxygen, at some point that cell can die because of a lack of oxygen. And when a cell dies before its time, so this is early death of a cell because of a blood problem, because of a lack of oxygen, that is a specific term known as infarction. Cell death that occurs before its time is known as necrosis. Infarction is cell death before its time because specifically a cause of too little oxygen in the blood because of a blood flow problem. So let's look at some other examples. We've really already talked about this, where we see that there is a blockage in the coronary artery that is feeding blood to the myocardium or the muscle, heart muscle. And again, if it lasts for a long enough period of time, then there will be infarction or death of that myocardial cell. If we look at our example where there was a blockage or an embolus in any artery in any location, but our example was specifically down in the foot, this can lead to infarction of the distal downstream tissues. And again, this individual would initially have ischemic pain. That's supposed to be a warning sign that, hey, there's something going on. And then if that occlusion continues for a longer period of time, then there will be death of those cells, early death, which is known as infarction of those toe tissues. Another example of tissue death before its time, or infarction, is that, let's say an individual has had a stroke and they're in a nursing home because the stroke was pretty severe and they're not able to move. We use the term hemiparesis, and so they're not able to move very much at all. And they're reliant on healthcare providers to take care of them. And if there is too few healthcare providers or too few competent healthcare providers, and the individual lays in one spot for too long a period of time, that pressure that is on that portion of the tissue can have decreased oxygen, can undergo ischemia, and then if the situation is there long enough in the same position, then death can occur. Now, because of the scenario that I just gave you, there is a specific name for that, and because there's a lot of pressure on that portion of the tissue, it is known as a pressure ulcer or a stasis ulcer or bed sore or decubitus, because you can never have too many terms for the same thing. Let me give you some visuals, because this really will keep it in your mind that whenever there is any kind of pressure on any kind of tissue for a long enough period of time, then it can cause no blood flow and infarction of the tissue. But this is known in this scenario, because of immobility, that this is a pressure ulcer or stasis. Stasis means to stay, to not move. The blood is not moving, and therefore new oxygenated blood is not delivering O2 to these particular tissues. Now, this is kind of your first introduction to here's what it is to be a healthcare provider. And our job, one of our job, is to prevent pressure-related ischemic problems. And again, there are lots of activities that a healthcare provider can do to prevent this immobility and a pressure ulcer formation. Let's talk about another kind of cell injury, and that's carbon monoxide poisoning. Now, this isn't a physics or chemistry course, so we're just going to say that, carbon monoxide is odorless. It's something that is produced because of a chemical reaction. It's often found in malfunctioning water heaters, gas heaters, water heaters, or gas heaters, house heaters. And so that is a population, anybody can be at risk, which is why they made carbon monoxide devices, protection devices, alarms. Now, why is carbon monoxide a problem? How can carbon monoxide poisoning occur? Well, carbon monoxide has a higher affinity for hemoglobin. In other words, if you picture a hemoglobin molecule and then there's two runners that are going to run towards the hemoglobin molecule, if you have an oxygen runner and a carbon monoxide runner, the carbon monoxide runner is always going to beat out the oxygen. It has a higher affinity. And when the carbon monoxide is bound to the hemoglobin, carboxyhemoglobin then becomes the new term. Again, medical terminology is just your friend in this course. And whenever the carbon monoxide binds to the hemoglobin, well, it takes up the space that oxygen should be on, and so therefore there's no O2. And we know that if the cell does not have O2 because of carbon monoxide toxicity, then the individual is going to have problems in their ability to make ATP. And the signs and symptoms of carbon monoxide, they're very vague. They start out with headache and giddiness, confusion, seizures, and coma. What is the treatment? Well, the treatment is first getting the person away from the carbon monoxide environment, and then moving to 100% O2. And this may not make sense to you because you're like, well, wait a minute, doesn't carbon monoxide hang on to the cell? Well, or the hemoglobin? And the answer is no. When you get rid of the carbon monoxide and now you allow oxygen to be present when the individual breathes, then that oxygen will displace the carbon monoxide. How much oxygen? Lots of it, 100%. You and I breathe 21%. So our oxygen in the atmosphere is not that high. Another kind of cell injury is abnormal cellular accumulation. Now, what does that mean? Well, it means that sometimes there are substances that become high in the blood, and the body says, I don't like this substance in the blood, and so it kind of shoves or pushes the substance from one space into the cell. So it basically tries to hide substances into the cell. So the proper definition is a cellular accumulation occur when substances accumulate in the cells pathologically. In other words, they're not supposed to be in the cell, and when they get in the cell, they interfere with cellular metabolism. That's why it's known as cell injury, because abnormal cellular accumulations will cause cell injury. Now, what's an example of abnormal cellular accumulation? The first one we're going to talk about is lipids. There are some individuals that are genetically predisposed for fats to kind of accumulate in the liver. And if you look at this previous picture, how pretty this liver is, pretty in pink, and then you look at this cross section, you can see that this yellow substances is all the fat that has accumulated in the cells. Now, this can also occur with alcoholism, and either way, it will cause abnormal liver function because it will cause injury and ultimately death of liver cells. Another kind of cellular accumulation is from urates or uric acid. And whenever uric acid accumulates, this is known as gout. Now, gout occurs because of a systemic or a buildup of uric acid. So this is kind of our picture representation of the buildup of uric acid in an individual. And of course, the fancy term for elevated blood levels of uric acid is hyperuricemia. Again, identify this term because sometimes terms sound alike. We know hyper is elevated, uric is uric acid, anemia in the blood. Now, what is uric acid? Well, again, you have to be a chemistry professor to understand that uric acid is a breakdown product of purines, which is an organic compound found in all cells. Don't know what that means, but just know that purine is supposed to be excreted, or purine breakdown and uric acid production is normally removed in our urine. But individuals with gout will have hyperuricemia and the inability to excrete this uric acid into the urine. And so what happens is with hyperuricemia, this elevated uric acid is bad for the body, and so the body will kind of shove it. It will first form a crystal, and then it kind of shoves it or accumulates it in the joints. And what happens when that occurs is that the uric acid will cause inflammation. And so that is kind of evidenced here by this redness, and there is probably some swelling, and it causes intense pain. Now, for whatever reason, when individuals have hyperuricemia and elevated blood levels of uric acid, that uric acid crystals seem to settle more commonly in the metatarsal joint of the big toe or in the ankle. Can it settle in the fingers? Sure, it can. It can probably settle in any joint. It's just most commonly settles in the big toe and ankle joint. Can this problem, uric acid overproduction and collection, hyperuricemia, be treated? Yes, it can. We encourage these individuals to eat a diet that is low in foods that contain purines, and those are the good stuff: the red meats, cream sauces, red wine. And then they'll also take medications to help reduce the uric acid in the blood. So it's really a twofold treatment. I had a friend who had gout and always tried to avoid beef, red meat, could tolerate pork a little, but mostly had to eat poultry, because whenever he had a large meal of beef, then even though he's taking medications, he would have joint pain. So it can be crippling, as far as it can cause people such intense pain that they're not able to work on the day when these episodes occur. Let's talk about another type of cellular injury, and that occurs because of free radicals. What are free radicals? Well, free radicals can be thought of as a separate molecular species. Then they don't behave like normal atoms or normal atoms and molecules. Again, if you're a chemistry major, then you're likely not listening to this lecture, but it would make more sense to you. So the expectation is that you just know what's on these slides, because free radicals, to my mind, don't really make a lot of sense. What do free radicals do, or why do they create a problem? And that's because they act differently. They are a spin-off of abnormal, accelerated, or uncontrolled reactions. So in other words, they cause abnormal, accelerated, and uncontrolled reactions in the body. And okay, so what? Well, what happens is when free radical producing reactions occur, or let me rephrase that. What is going to cause the individual to make free radicals? Okay, so this is saying typical generators. In other words, how do we produce free radicals? And free radicals are produced from simply aging. They are produced as a result of exposure to environmental pollutants, drugs, certain alcohol, various types of radiation, Too much sun, certain foods, certain preservatives are huge generators of free radicals. Now, an example of a specific free radical is superoxide. And superoxide is at times it's created in our own body. Again, it's really created in response to these things that we identified up here that generate free radicals. Now, what do free radicals do? In other words, what problems do they cause? Well, once created, free radicals, such as superoxide, can destroy cells throughout the body. So they react with this phospholipid layer. They react to the lipids in this cell membrane layer, and they cause lipid peroxidation. In other words, the free radical punches a hole in the cell membrane, and that's going to cause cellular leaking. And they will also attack the proteins, such as these transmembrane proteins. And these proteins are very important for the cell's functioning because they bring things from the blood into the cell. So they're very important. The free radicals will damage DNA, which can cause altered protein synthesis. It can cause gene mutations. They'll damage the mitochondria, which is responsible for doing the Krebs cycle and making a bunch of ATP. And it is thought that free radicals can directly lead to cancer because of all the damage that they do. So it is linked to cancer. Now, counteracting free radicals can be helped or aided with certain vitamins, such as vitamin C and vitamin E, because these two vitamins can stop the wild molecular behavior. Where do we get vitamin C and E? Well, here in America, most of the time, we get it in a pill form. But this is why you're always told by your parentals that eating fruits and vegetables keeps you healthy, because fruits and vegetables contain a lot of the vitamins that will stop or inhibit the production of free radicals. Now, the body does have the ability to defuse the free radicals, and the diffuser is known as superoxide dismutase. So that makes sense. If our free radical is superoxide, a free radical diffuser is going to be superoxide dismutase, an enzyme. So here's your pictorial representation to remember or remind you that when free radicals are formed, calming agents, vitamins E and C, and superoxide dismutase will get rid of our free radical. Now let's talk about another item, and that's cellular proliferation and the alterations that can occur with cellular proliferation. First, what is cellular proliferation? Well, it's the multiplication or reproduction of cells resulting in rapid expansion of cell population. Is this abnormal? Why, no, it's not. If you did not have multiplication and reproduction of cells, then you'd still be an infant, because that's what allows individuals to grow and develop is cellular proliferation. And so therefore it is a normal growth and development of cells. Now we are going to use a specific example of cellular proliferation, and that's in the hematopoietic system, which is basically the blood system. So we know whenever a white, a red, a platelet, any of those blood cells are needed, there is a very generic stem cell that is made, and then through various hormones, that stem cell differentiates, and it becomes either a white or a red or a platelet and anything in between. Do you need to know this slide? No. What do you need to know is that cellular proliferation occurs, but it's very controlled. The body says, make a cell, we make a cell or two cells, and then the body says, stop. So there is a specific order to cellular proliferation. There is a specific order in what cell is made and how it grows and develops. In other words, that differentiation of a cell. So all of this is done in a very controlled manner. And anytime there is an alteration in cellular proliferation, then certain diseases can occur. And one of those alterations in cellular proliferation is known as cancer. When we define cancer, there is many different definitions, all of them shoved in this slide. Cancer is defined as a tumor. So tumor, cancer, synonymous, an abnormal mass of tissue that is not needed. In other words, we don't need this cancerous or abnormal tissue to replace working healthy cells. We don't need that. The body has somehow made a mistake. Now, another term is neoplasm, and that is abnormal new growth. Now, tumors, when they're developed or when they are created, they can be a malignant tumor or a benign tumor. When we talk about benign tumors, even though I said cancer tumor, benign tumors are not cancer. And a lot of people will say, I have a tumor, I had cancer, and that's really not true. If it's benign, it just means that it was an abnormal mass of tissue. Sure, it's tissue that was not needed, or it was an abnormal new growth, but it wasn't cancer per se. It wasn't cancer per se. So benign tumor, when the word benign is in front of tumor, it just means an abnormal growth. Now, what are the key characteristics of benign tumors? Well, they're slower growing than malignant tumors. Their area of growth is well encapsulated. That means it really stays in one spot, and it stays in the spot from which it came. So there was some kind of abnormal cell that was created, and if it's benign, then even though the cells do multiply and they do grow into more cells, they stay within a certain space. They don't really go anywhere else. That means non-metastasizing. And most of the time, if a biopsy was done, in other words, if that cell structure of the neoplasm was looked at under a microscope, they would essentially look fairly close to the cells that they came from. An example of a benign tumor is a lipoma. Now, a malignant tumor or malignancy is interchangeable with cancer. So again, tumor, malignant tumor is also cancer. The key characteristics of a malignant tumor, again, very important, are very rapid rate of growth, and cells are poorly differentiated. In other words, they're just kind of blobs, and they just kind of sit there and they take up space and they don't do anything. They do nothing to help the body in all of its movement and activities. The location of a malignant tumor, it can occur in a specific site, or it can metastasize, or there can be metastasis. In other words, this refers to the propensity or the tendency of malignant cells to invade distant sites to the area of origin. Now, metastasis is what causes the illness and death, because as more and more cancer or malignant tumors metastasize, then it really does disrupt and injure a lot of different cells in a lot of different areas. Now, some cancer by nature is widespread. That's leukemia. That's cancer in the blood. The field or study of cancer is known as oncology, more medical terminology for you. So let's talk about the causes of cancer, or the etiology. So the basic etiology is a gene mutation. And it can be prompted, the gene mutation can be prompted by various factors. Again, aging, wear and tear of the cells. If you think about taking a piece of paper and making a photocopy, then the next photocopy looks pretty close to what the original looked like. But if you made 7,000 photocopies, well, number 7,000 is not going to look quite the same as the original cell. So as cells age, They take some hits to their DNA. There is a hereditary factor, as in certain kinds of breast cancer has a tendency to run in families. There can be environmental influences, such as free radicals and carcinogens, in other words, cancer producing items such as tobacco, alcohol, certain drugs, ingestion of dietary substances, air pollution, occupational hazards, lots of different things can cause these gene mutations. And then put a circle around this one. Students always forget this. Invading organisms, such as viruses, can lead to cancer. So some specific examples, we look at human papillomavirus. This is contracted sexually. It can cause cervical cancer in women, but HPV has also been linked as a cause of mouth and throat cancer. So when you look at this individual, this is Michael Douglas. He was very open about his sexual exploitations or sexual conquests, and that he developed throat cancer from human papillomavirus. So I don't think I need to draw you a map and tell you how HPV that originates in the cervix of a woman can land in the mouth of another person, but it is a risk factor for throat cancer, and that is why it is so important for both men and women to get the vaccine, the HPV vaccine. Hepatitis B virus, HBV, and hepatitis C virus, these are viruses that can cause hepatitis. Hepatitis means inflammation of the liver, and when it is specifically caused by hepatitis B or hepatitis C, this can cause liver or can lead to liver cancer. Let's talk about the mechanism or action in cancer genesis. In other words, how is it that cancer begins? So it doesn't matter whatever the initiating factor. Again, it can be drugs, chemicals, smoking, free radical production. It doesn't matter what it is. But what occurs is that during exposure to something, it causes a hit or it causes a mutation in the DNA. So remember that our DNA is in strands. There's times in the cell lifespan that it's scattered all over, and then whenever the cell is about to divide and multiply, that DNA kind of is supposed to combine and go back to its original strand in its original shape in its strand and chromosome. And so if there is some kind of mutation that occurs during the kind of formation of the DNA, then that could cause the creation of what's known as an oncogene. So whenever that DNA is not put back together the way it should, then it will create the oncogene. And so the oncogene is the first cell, the mother cell of cancer formation. And what happens with the oncogene is the oncogene promotes clonal proliferation. So this original cell that was created that is a gene mutation, that has a gene mutation, that oncogene promotes clonal proliferation. And so when you look at this picture, you can see that not only are there lots and lots and lots of cells that can be made by the oncogene, but they're all the same. And they lose their differentiation. In other words, they don't change and become a working cell. They are just taking up space in the body. The other thing with the oncogene is there is an overriding of the normal braking systems. In other words, whenever a cell multiplies, it's only supposed to do a very controlled multiplication. And with the oncogene just makes and makes and makes and makes and makes and makes more cells that don't differentiate. They have loss of differentiation, anaplasia, and they don't do anything. Now, how do these cells that are being formed or proliferated, how do they survive and do well? Well, they're very clever. And these tumor cells or cancer cells can create their very own blood supply, and that is known as angiogenesis. So when there is angiogenesis, you can see here, you've got this small little mass that has been created, and then that mass, blood vessel mass, can cause angiogenesis and create its own blood vessel growth, and that is how it gets its nutrients. And as it grows and grows and grows, it will steal or divert a lot of the nourishment from the healthy working cells to the cancer cells, and that is what will cause the demise or the problems with the individual, because the healthy cells are not getting the nutrition they need, and the nutritional things are going towards the cancer cells, which aren't doing squat in the body. How is cancer diagnosed? Well, there are lots and lots of different tests, CAT scans, MRIs, different x-ray tests, a biopsy, but there is also some blood tests that can be done, in fact, to look for tumor markers or genetic markers. So what are tumor markers? Well, tumor markers are substances in the body that are either produced by the cancer cells or they're released by the cancer-damaged tissue. One example, because the tumor markers could be a hormone, an enzyme, an antigen, but one example that you have to know is that the PSA, prostate-specific antigen, is a type of substance, an antigen, that is found in prostate gland cells and then released into the blood when cancer invades the prostate. So in other words, these damaged cells will release more and more and more PSA as more prostate cells are damaged. So we can use this PSA, prostate-specific antigen, as a marker, if it's elevating, that perhaps there is some kind of prostate cancer that's used. And so that's why the PSA is a screening tool, and men who are 50 and above should have it done. A genetic marker, there's several different genetic markers that can occur. We're going to talk about one. And these genetic markers can either predict the odds of having certain types of cancers or can actually help with the diagnosis of certain cancers. So let's look at one of our course examples, and this is the Philadelphia chromosome. Now, the Philadelphia chromosome is used to diagnose chronic myeloid myelocytic leukemia or myelogenous leukemia, either way, CML. And no worries about these abbreviations. I will spell it out on the exam if I'm asking about this. So CML. And what is the genetic marker? Well, the genetic marker occurs because of translocation. And what happens is in our normal bodies, we have a chromosome number 9 and a chromosome number 22. And what will happen is that whenever this chromosome is dividing and then returns back whenever the cell is about to multiply, there is what's known as a translocation, and that is when a portion of chromosome number 22 will get located or translocates on the chromosome number 9, and then a portion of 9 will translocate on number 22. And it just so happens that this chromosome that is developed, that is a portion of 9 and 22 that shouldn't be paired together, that are now paired together, this is known as a Philadelphia chromosome. And what happens is this chromosome just so happens to be responsible for the creation of white blood cells. Now, the fancy term for white blood cells is leukocytes. So when this chromosome is created, then this chromosome, instead of creating normal white blood cells, it will now abnormally code for the synthesis of abnormal white blood cells and the overproduction of white blood cells. So there will be a lot of white blood cells that are made, and so we call that extreme leukocytosis. And this extreme leukocytosis, a very elevated amount of white blood cells, is known as leukemia. And there will be a specific diagnosis of CML whenever this Philadelphia chromosome is identified in a patient who presents with leukocytosis. Now, why do we need to identify the Philadelphia chromosome? Because it's about treatment. There are several different kinds of leukemia, and to treat specific types of leukemia, you need to have a specific diagnosis. And so if you go to medical school, these are the things, and become an oncologist, these are the things that you will have to do, is you will have to give a specific diagnosis. So let's make sure that you know the terms, because these are going to be important for you to know as part of your course material. That leukocytosis is a generic term meaning too many white blood cells, but leukemia is more of a specific term, that is a disease of the white blood cells, and therefore, again, a specific diagnosis of CML is identified when the Philadelphia chromosome is seen. Let's talk about cancer staging, because that probably any patient who is given a diagnosis of cancer wants to know, well, tell me, how far is it spread? How bad is it? What's my likelihood of recovery? And assistance into the knowledge of what the diagnosis and prognosis might be is helped with staging. There are several different ways to stage cancers. We're going to look at one, and that's the T&M system. So the T&M system consists of T for tumor, N for lymph node, and M for metastasis. So when we look at T for tumor, we're looking specifically at the size of the tumor, and there can be a lot of different numbers that are used. I've just said that T1 through T3. In other words, T1 is going to be a tumor that's a very slow or a smaller size, versus the T3 is a higher size tumor. And then T0 means that mass or neoplasm is not really a cancer cell. It's just a mass of regular cells that have just clumped together. N means the extent of spread to lymph nodes. And again, N0 means no spread to lymph nodes, but N1 and above, it means there's going to be more and more and more spread of the tumor to the lymph nodes. And truly, any spread to lymph nodes is a bad thing, because once it's in the lymph node, it has kind of access to lots of blood flow, lots of lymph flow, and therefore there is a higher risk that it will move to different locations. So N is always bad. N0 is the best. Metastasis means it is spread to other tissues beyond not only local lymph nodes, but also to local organs. In other words, if you had a colon cancer that was originally diagnosed, and then now you have it spread to another organ, such as the liver, that's a bad thing. M0 means no metastasis. M1 and higher numbers mean that it is spread to multiple organ systems. So again, I want you to know that the tumor size is not as important unless it's in certain locations, but the tumor size is not as important in the diagnosing and prognosing as the spread to different areas. So if you had a patient that was told, well, we've removed this lump, this abnormal neoplasm, and it's T0, N0, M0, then what does that mean? Well, it means that it's benign tumor, and the individual would know, well, they don't have cancer, they just had an abnormal mass or abnormal neoplasm. Classification and naming of tumors, this is where we get into supreme boredom. There's really no way to make this fun, but you have to know the naming of the tumors, and you're going to be asked one question. So if you're the type of person that says, I don't want to make 100 on this test, I'm going to skip over this, feel free. But let's look at some kind of black and white gray rules that you can use, and that is that benign tumors usually end in OMA, In other words, a lipoma is a benign fatty tumor. A leiomyoma is a smooth muscle benign tumor. So oma, benign. Malignancies are usually named according to the cell type of origin. Again, if you go to medical school and become a pathologist, you'll know all the different cell types. So there will be oma, but there will be another term with it. In other words, carcinoma or sarcoma or blastoma. And so we look at here, we have a hepatocellular carcinoma and adenocarcinoma. So if it was benign, it would just be adenoma. Malignancies involving connective tissue, osteosarcoma, so there's our sarcoma, or hemangiosarcoma. So sarcoma is malignant. Malignants involving smooth muscle, again, more sarcoma at the end of the term. Malignant tumors are going to have blast with the oma, so neuroblastoma versus a neuroma is going to be benign. Now, there are always exceptions. You can see that lymphoma is a type of cancer. Excuse me. I'm not going to ask you about the exceptions because I said black and white. So sarcoma, blastoma, and carcinoma, those are malignant, whereas just plain old oma is mostly benign. Now, let's talk about signs and symptoms of cancer. This is something you do have to really know. So cancer can be in many different body systems, and so the signs and symptoms are going to vary depending on which organ is affected. But there are certain signs and symptoms that are pretty much unique or kind of non-specific to just about any individual with cancer, and that's going to be pain. And the reason why there's pain is because that neoplasm is taking up space. And it could be actually compressing on the nerve, or it can be stimulating inflammation, and the substances involved in inflammation will cause nerve irritation. So pain is usually a common sign and symptom. Fatigue is also a common sign and symptom to most every cancer because of the angiogenesis, and it's very important that these tumor cells leach or divert or take away the nutrition that the normal working cells really do need. Cachexia, or cachectic, is an adjective. This is really talking about an individual who is very thin. But it's more than just being thin. It's in addition to thin, it means that they don't have an appetite. That's what anorexia means. And there's early satiety. That means that an individual doesn't have much of an appetite, and when they do eat, they're going to take a bite and feel full. They'll have weight loss, they'll be weak, and of course that's all due to altered cellular metabolism of those working cells because they're not getting the nutrition that they need. They can have sunken features and just a malnourished appearance. Now, your body is greatly dependent on, or your blood cells are greatly dependent on the ability of the body to function well. And so often, whenever the body is not functioning well in any location, then for whatever reason, the bone marrow is just not able to produce enough of the blood cells. So individuals can have all blood cell level abnormality, anemia, fewer red blood cells, leukopenia, fewer white blood cells, and thrombocytopenia, fewer platelets. Cancer treatment, a variety of cancer treatments exist, and they're listed for you here. Now let's talk about another alteration in tissue and cellular proliferation, and that's cellular adaptation. We know that our cells have the ability to compensate or adapt to different environments, to different situations. And so we're going to talk about the abnormality or the adaptation of different cells. And the first one is atrophy. So you have to know what could cause atrophy and what it means. So atrophy means the decrease or shrinkage in cell size. It does not mean fewer cells. It means shrinkage of the cell size. So when you look at your picture here, you can see in relation to normal, our cells have shrunk. And this is because of either the cell is not working very much, such as individuals who just sit on their couch all day long, or because individuals have had some kind of fracture and therefore they've been placed in an immobilization device and therefore not moving because of that fracture. So it's when the cell shrinks because no longer stimulated to do much work. What about hypertrophy? So hypertrophy means an increase in cell size. Again, notice 4 cells here that were normal, and now there's still 4 cells, but they're bigger in size. And this is related to an increase in workload of the muscle. So we know that it can be for bodybuilders, but it can also be for individuals such as the heart muscle can hypertrophy if it is made to do more work. And this can be an abnormal situation, or probably in the case of Lance Armstrong or some of your extreme athletes, these individuals, they have perhaps hypertrophied hearts. What about hyperplasia? So when we look, if you go back and look at normal, there were 4 cells. Hyperplasia is an increase in the number of cells, so it's different. It means more cells, and this is because of an increased rate of cell division. And there are certain cells that in certain organ systems or certain types of cells that cannot do hypertrophy, they do hyperplasia. That part you don't need to necessarily know which cells do hyperplasia versus hypertrophy. You just need to know the meaning of hyperplasia, that it's an increased number in cell. Metaplasia means the reversible replacement of one mature cell by another type of less differentiated cell. So this happens when cells are subjected to chronic irritation. In other words, if an individual is smoking, they will have, and they do this on a chronic everyday basis, they will have a metaplasic change. In other words, the cell looks a little bit different. And then there's dysplasia. This is an abnormal change in size, shape, organization of mature cells due to persistent cell injury, and this is considered precancer. So again, think of dysplasia as precancer, metaplasia as just kind of a sign and symptom of chronic injury or irritation. Now, when we talk about another concept, I want to ask you, what does a cubitus bed sore or a stasis ulcer have in common with cellular atrophy? What do the two have in common? And the answer, hopefully, you thought about, was both occur because of immobility. And in our lives, really, the body is meant to be in movement. And anytime there is an alteration in immobility, such as individuals who have a fracture or surgery or whatever state or problem occurs, then problems can occur not only from the original problem, such as a stroke or pneumonia, but problems can occur because they're immobile. And so the longer the patient or person stays immobile, the greater the level of debilitation that can occur. So as we go through the course, I kind of have a cutesy little diagram where we're going to identify problems or complications that can occur because of immobility. And so we've really already identified that problems with an immobility can occur to the skin. There's a risk for development of breakdown and pressure ulcers. And then muscle cells can atrophy or shrink because of complications from immobility. So there are some specific nursing actions that can be accompanied to help aid individuals with immobility. There's also another occupation, such as occupational therapy and physical therapy, that are created or that are present to help patients because of immobility. But as we go through the course, again, we're going to identify the complications that can occur with immobility as well as some treatment. Not going to ask you too much about treatments. These are going to occur as you get through the nursing program, but you just need to be aware that nurses make a difference and their actions can help prevent complications of immobility. If you have any questions, please email your instructor. This concludes the content for Exam 1. Good luck on the test.